distal aspects of posterior sextants and the palatal or lingual aspects, wherever you can kind of best fit them based upon where you're sitting and the patient is. However, we'll get into the distal here by looking in there, placing it in, looking at the ultrasonic, and then looking at the screen and start moving around so you can start seeing some sort of action. Watching yourself clean here, clean all the way to the distal lingual line angle, so you kind of retrace your corner here. Then go into the palatal here, from the palatal on the distal here, clean. Then go into the distal here, the distal of the premolar. Try to get as far to the facial as possible. The distal of the cuspid, the distal here, and then the palatal, distal here and palatal. And if the patient's having, again, if the patient's having a problem with the water flow, then you may need to just do this when you get to the other side. Now, sometimes at the very distal aspects of these furcations, the angle that we have on the ultrasonic isn't angled back enough. So in the case of not being able to reach a certain area with the straight one because it doesn't angle back enough, then, well, I was in the spot, I will use the curved ultrasonic. And these curved ones are basically the right and left versions, but we curve the distal end a little bit more like a furcation probe, and it allows us to instrument these areas in these concavities or just some areas where you just can't access the root with the straight one because it doesn't angle back enough. Now you could try bending it kind of in situ, but if you have these, you generally don't have to do that. And normally this is the only place I use those is on the distals here. Sometimes into the furcations from the buccal or the mesiolingual, but not much. So I've reset my instruments and I've reset my patient. I normally have my patient straight up. Again, the saliva ejector's back here. I've changed to the red or the right viewing explorer, and I changed back to the straight ultrasonic. So as I normally have to kind of push the cheek up and out of the way and push the explorer right into the distal buccal corner of the second molar. But I don't really have to see it, I just kind of feel it, and then I get the ultrasonic in there, and this is probably the easiest place for me to just look up and I'm seeing everything all in the frame, and then I start cleaning at the distal, watching the screen, moving to the mesio. If something slips out, you have to look back in the mouth, reposition things. Sometimes actually you don't. You just kind of feel your way back into the mesio here, angle it in. Sometimes you have to cross instrument, and because I don't want to turn the instrument or rotate the insert, I just tolerate the torque and just spin it, but I'm holding on to the handle. I don't hold on to the insert very often at all. It's better to spin something at a bigger diameter than it is smaller diameter. Okay, so sometimes I cross instrument, not much on the upper, definitely more on the lower. So I go here, I go to the distal buccal, clean around, into the furcation, look into the furcation. Sometimes you really have to wiggle these things around to get a good view of things. Okay. A lot of times there's not pocketing there, but I'll just kind of scoot by there and concentrate on the mesial. Then Go to the distal here. You know, sometimes there is pocketing here, really deep pocketing, so you're just kind of looking all around. A lot of times the patient will be at about this angle. And, sorry, I'll have to just angle the microscope a little differently. Okay, cleaning here. You can look pretty far into the distal here, although I still use the angled one to look at that one. In the middle here, distal, toward the midline. You know, this you can get a lot of use out of just the right one and all the anteriors. You might have to move the patient over to the side when you get over here. A lot of times the water flows this way, so that's kind of nice. Okay, get in here. Sometimes you have to contend with the lip getting over the camera. One of the things I'm looking at is different kinds of retractors, lip retractors and stuff like the Optragate, or these retractors I got from a friend of mine, Mark Gottlieb, in New York. Really affordable retractors, and they get kind of everything out of the way. So you can go into here, and then pretty much you're done with the right Explorer. Okay, so I've shifted instruments, and now I'm using the red or the right Explorer, the right Explorer bent back to the right. So a lot of times I'll push the cheek out of the way and get this into the distal here, come over the occlusal and start looking for on the screen for me watching what I'm cleaning, and then use my vision on the screen just to kind of guide myself around back in here, looking at the palatal root, looking at the distal buccal root, cleaning. Sometimes I have to get in here from the same side just to clean. A lot of times it's cross instrumenting, and then looking at pocketing on the buccal aspect of the palatal root there, then moving along and going into the distal of the next tooth, and sometimes cross instrumenting here just to make sure you're seeing everything. Going into the distal here. A lot of times you don't need to cross instrument there because you can get this quite a ways toward the palatal. Clean here, and then I'm done with this segment, so I'm going to change. I'm going to be going to the upper right now, and I'm going to change this back to the right.